Well, good morning. I'm Rick Stevens, president of Christian Hospital, and welcome to our virtual Community Leaders Breakfast. As you know, we typically do this in person, and you have a great breakfast. So hopefully you're having a great breakfast right now while you're joining us here this morning. And welcome to our topic for today, Medicaid expansion here in the state of Missouri. And I have a great panelist here this morning as well. And I'd like to take time to introduce the panel as well. And I'll start off with Leanne Chilton. Leanne serves as the Vice President of Government Relations for BJC Healthcare. Leanne manages the public policy and external affairs for one of the largest nonprofit healthcare organizations in the United States, which is BJC, delivering services to residents primarily in the greater St. Louis, Southern Illinois, and mid-Missouri regions. Leanne works collaboratively with elected and appointed government officials at the state, local, and federal levels on behalf of BJC and service lines including inpatient, outpatient care, primary care, community health, wellness, workplace health, home health, community mental health, long-term care, and hospice. Prior to joining BJC in 1999, Leanne worked in Denver and Washington. So welcome, Leanne, this morning.
Morning.
Bishop Larry Jones. Bishop Larry O. Jones is senior pastor and founder of Greater Grace Church in North St. Louis County. Greater Grace Church is continually growing and is a community-minded church. Bishop Jones is the diocesan bishop of the Midwestern District Council of the Pentecostal Assemblies of the World Incorporated and oversees about 60 churches in the diocese. He currently serves on the bishop board of the Pentecostal Assemblies of the World. Bishop Jones is an excellent teacher of the Bible, with a vision to help people live a successful life by biblical principles. Bishop Jones is married to Nina Jones, and they have two children, Larry II and Tyler. Welcome, Bishop Jones, this morning.
Thank you. Thank you.
And we also have Dr. Anna Fati, who works here at Christian Hospital, who has been in practice for 18 years. She's an internal medicine primary care physician working out of the St. Louis Primary Care Office here in the North County as well. Welcome, Dr. Anna Fati.
Thank you.
And then last but not least, Michael Whittier. Michael serves as the coalition's director for the Yes on 2 Healthcare for Missouri campaign. He has served with the St. Louis Integrated Health Network since October 2016 as the strategist overseeing justice system and health equity strategies. Prior to joining IHN, he served in various roles at Mercy Hospital, St. Louis. Additionally, Michael represents IHN on the Regional Health Commission's Advisory Board and serves as the co-chair of Barnes-Jewish Hospital's Community and Faith Advisory Council. In these roles, he aids the advancement of health equity solutions that are important in addressing health disparities in the St. Louis region. He is a professor at St. Louis University. He received his master's in healthcare administration from the University of Missouri and is currently a doctoral candidate in business administration at Liberty University. Welcome, Michael, this morning.
Thank you. Thank you for having me.
So I'd like to start off with several questions to our panel. And since we're talking about Medicaid expansion, sometimes people get Medicaid and Medicare confused. So I'll start off with Leanne. So just tell us, what is Medicaid currently in our current state? And then what is Medicaid expansion?
Thank you very much, Rick, and welcome to everybody. I usually am at those breakfasts, so I am missing that hot meal that you typically serve. And I miss seeing your faces. This is an odd one for me. Those of you who know me know I walk and talk, so you're going to see me move my hands a lot, I guess. It's fitting that we're having this conversation at Christian Hospital. Rick Stevens did not introduce himself because you all know him, but he also happens to be my co-chair of Medicaid expansion, something that BJC has pursued for almost a decade. And Rick has been on this journey with me the past 2 years as we pulled together this very diverse coalition. So Rick, tip of the hat to you, my friend. You've been an awesome colleague in trying to get this done. So Medicaid is different than Medicare. Medicaid is the state government provided insurance that is in Missouri, has very low eligibility levels, and we'll talk about that in a second. But it was part of the Affordable Care Act. It was part of the ability to make sure that all people were insured. There were 3 really different buckets, right? There was the bucket that included workers that were currently insured by their employer. It included an insurance exchange for those people who could buy into a group insurance plan. and it included an expansion of Medicaid so that all people who are low income could get insurance. By low income, I mean those that are making about 18,000 and under as an individual. In Missouri right now, we're one of the now 13 states that have not expanded Medicaid. And in Missouri, our eligibility levels are the lowest, I believe, lowest in the country. Michael, correct me if I'm wrong, but I believe it's the lowest in the country. What that means is that if you are a low income custodial adult, you can make no more than $3,600 a year and keep your insurance. If you're age, blind, or disabled, you can't make any more than about $11,000 a year without losing your Medicaid coverage. And if you don't have any children at all and you're not taking care of anybody, a non-custodial adult cannot get Medicaid at all in the state of Missouri. So what Medicaid expansion does is it, like those 37 other states, increases it up to that 18,000 a year level for an individual. And I know we're going to talk about mental health and the disabled and people with chronic illnesses. Those are the people that are in the gap. Those are the people we're trying to get into insurance. Medicaid was part of the Affordable Care Act. It is the law. We need Missouri to move forward. And that's basically why we're on the ballot on August 4th.
Yes, absolutely. That is why we're on the ballot for August 4th. And so I'll go over to Michael, and you've talked a little bit about the eligible requirements, Leanne, as well. So, but what have other states done, Michael, as well with Medicaid expansion? Have we seen a repeal in other states that have expanded Medicaid? Because that seems to be a question people are saying, we can't afford it.
Yes, and that is a question that comes up a lot. And the honest truth is, of the 36 states that expanded Medicaid prior to 2020, with 37 making Oklahoma this past July, but of that 36, 0 have repealed Medicaid. And I know we'll get into the cost savings, we'll get into the economic and fiscal impact a little bit later in the panel. But what we see, no matter if it's a red state, a blue state, a purple state, 0 have repealed Medicaid because there's so many benefits. And so that's why we really celebrate as a campaign the diverse coalition that has come on and endorsed Medicaid expansion here in the state, making the Coalition for the Yes on 2 campaign one of the most diverse in Missouri state history. And so that's something we really celebrate, and we are thankful for all the great support and just aid, just community organizations like BJC, Christian, Greater Grace Church, and others throughout the state, and the pivotal role that they have played, because again, it is so critical we get this expanded, and we see the benefits. And again, 0 states have repealed it.
And so when you talk about a diverse group supporting it, I think that's maybe something we should maybe just talk a little bit more, because what has been that total number, Leanne or Michael? How many groups are supporting expansion right now in the state of Missouri?
Right now, as of yesterday, there were over 345 endorsing organizations, and those are organizations ranging across the political spectrum, community affiliation. You saw the Archdiocese of Missouri, which is an extremely conservative decision-making process for them. Same with the Missouri Chambers of Commerce, but then you see the Organization for Black Struggle, you see the Urban League, St. Louis and Kansas City, you see the NAACP coming on and supporting it. So you see it from grassroots organizations that are considered liberal, quote unquote, all the way to those who are considered conservative, quote unquote. That's why we really say this is a bipartisan issue. If you try to get into the weeds of the partisan issues, that really gets away from the benefit of all Missourians. And we want to continue to elevate those key talking points, those key messages, because it is beautiful to see how Missouri has come on and spoke and said, okay, enough with no action in the legislative process. We're going to take it upon ourselves, do a ballot initiative, and not only did we get enough signatures across the 8 congressional districts, we turned in almost double of what was needed. So it was truly amazing to see the hard work that many organizations and many people put in to get us to this point.
You said one more point I want to stay right there on. You talked about the number of signatures. And the number of signatures, correct me if I'm wrong, Michael, Leanne, over 300,000, I believe. And you said the 8 congressional districts. So that doesn't just mean St. Louis and Kansas City. That means there were rural areas as well that had that many signatures as well, correct?
Yes.
So that right there shows that's bipartisan, and a lot of people are really thinking about this as well. And so tax dollars. That's another thing. Who pays for this going forward? And maybe give a little history of when Medicaid expansion first started to where it is now.
Do you want me to take that, Michael?
Michael or Leanne? Yeah, either one.
Yeah, I could jump in and we could tag team it, Leanne, but okay. I don't want to monopolize the time. There's so many great speakers this morning. But Medicaid expansion has been around for quite some time, and it's an actual myth that it actually started after the Affordable Care Act. The Affordable Care Act actually incentivized Medicaid expansion. Medicaid expansion was around, and we've seen that happen as early as 2000 when Maine expanded their eligibility. And so this is something that has been around for a while, and in an effort to increase access, increase eligibility for those who are most vulnerable. And so the 2012 Patient Protection and Affordable Care Act actually incentivized states to expand Medicaid, and it would cover, the federal government would cover 100% of the cost for that. However, now as we've gotten closer to 2020, we've seen that be reduced to 90-10 split between the federal government and state. And so there's been efforts since 2012 in Missouri to expand Medicaid. Yesterday, Medicaid turned 55. And so we celebrate that. We celebrate the leaders who have sacrificed a lot, like the Medicaid 23, the clergy who were arrested in the Missouri State Legislature protesting the inactiveness of the Missouri State Legislature on expanding Medicaid. And so there has been a lot of sacrifice, a lot of hard work, decades of just advocacy that has really gotten us to this point.
Anything to add there, Leanne?
I think on the cost side of it, Michael is absolutely correct. Under the Affordable Care Act, 90% right now and forever will it be, unless they totally change the law. Every state now that has expanded gets 90% of their funds from the federal government. Those are taxes that we are paying in Missouri, sending to Washington, that are not coming back to Missouri. So 90% of the cost of the expansion population is covered by our taxes going to Washington, not coming back. The 10% we believe will not cost the state money. Initially, to be fair, there will be an implementation cost, but within a very short period of time, those folks that we've already talked about, the folks with chronic care conditions, the folks with mental illness, the people who believe they have no other place to go but the emergency room when they need care because they're uninsured, those costs will now be covered under that 90-10, and therefore our cost of the uninsured comes down. So for the states that have expanded Medicaid, people who are on the exchange, the insurance exchange, have seen a decrease of their premiums by 7%. So not only does it bring $1 billion a year in from Washington back to Missouri, it also allows those people in the gap to have coverage that they didn't have before, and it makes sure that we are taking care of people when they need us, not when they believe they have, in desperation, have to go to the emergency room to get their medicines or to get the care that they absolutely need, that everybody needs.
And Rick, if I can, I would just want to highlight something that Leanne said. This is cost neutral before we even begin to talk about the economic impact that it has on Missouri. So we've seen cost savings in other states. And so I just want to, again, reiterate that this is cost neutral before we even talk about the economic impact. And so there's fiscal responsibility to overhaul systems upon implementation to make this work, make it more efficient. But that's needed anyway. The state has agreed that that was needed for quite some time. We saw it with the disenrollment of children at a large number over the last several years. And so again, cost neutral, tax dollars back to our state that we're already paying, $1 billion by 2026. And again, before we get into the economic impact for everyone throughout the state and not just those who are expanded access.
Well, we'll come back to the economic impact because I think that's very important to talk about today. But let's talk a little bit from the community. So, Dr. Anafati, how do you see this benefiting your patients and what you see in the community? Because you're on the front lines, you're a primary care physician, you're usually the front door for a lot of people as they come in to get their health care. How do you see expanding Medicaid serving the individuals that you serve now?
I think this Medicaid expansion is extremely important, and I just want to describe it in terms of the experience of patients. When we talk about gap, Medicaid currently covers people up to the age of 18 when their income level is less than 22% of the federal poverty line. And then it picks up again when you're over age 65. As a primary care physician, I know that many of the chronic health conditions that are life-threatening and life-ending and disability-causing start in that age group of 19 to your mid-50s when people need health insurance the most. So during those gap years, without health insurance, without the ability to get the routine care that keeps your hypertension from progressing to stroke, from progressing to kidney failure, that keeps your diabetes from progressing to loss of limb, loss of vision, and other complications, people are vulnerable and they don't have access to the care. And so it's important to resolve this issue so that people are not left vulnerable. And then we've talked about COVID a lot because we're in the middle of this global pandemic. But that has also increased the risk of any one of us being vulnerable to poverty. Many of us see job loss happening in our communities. And so having an expansion of Medicaid becomes a safety net whereby you're not desperate. And I'm a primary care physician. I've heard patients calling my office, not because they have COVID, but because they've been hit by the economic impact of COVID. I've lost my job. My insurance is going to end by the end of the month. Is there anything you can do to get me the medications that I need while I still have coverage? The level of desperation, anxiety, fear, tears that we are seeing in the primary care office is distressing, is overwhelming. Medicaid expansion will help provide a security blanket for all of us during this vulnerable period that we are dealing with.
Bishop Jones, how do you see this helping the individuals that come to your church? But then also with you overseeing 60 churches, how do you see this helping the individuals at those 60 churches from a community, another aspect of the community as well?
Well, the one thing that I would say is that by the expanded Medicaid, it has stopped a lot of suffering in silence. There are people that need medical help, and yet they come to church, they want to increase their faith, but at the same time, they need medical attention. And without the coverage, without being able to see a doctor, their mortality rate is decreased. So I think we help greatly by the fact that, one, they can stop the suffering, see a physician, and increase their lifespan.
Yeah, you said something key there, suffering in silence. And one of the questions that has come in this morning, and a question I had, is on the issue of mental illness. And how will this help, Dr. Anafati, and this can be to everyone on the panel, how will this help individuals with mental illness? Because that's something that we're seeing in the community. A lot of people are traumatized. As you said, Bishop Jones, people are suffering in silence, whether it's from their chronic diseases, high blood pressure, diabetes, or mental illness. So how will this help those patients that have mental illness?
I think the most important thing to first understand is that mental illness occurs in a large portion of the population. Just talking about depression, over 60% of the general population have depression. And some of the more critical life-altering conditions, such as bipolar disorder, schizophrenia, they actually have an onset as early as age 19 to mid-20s. And psychiatry, if I could go back to medical school, I would be a psychiatrist today. Psychiatry is one of the most advanced specialties in healthcare in terms of the option of medications and treatment that people now have access to if they had insurance that can not only preserve their mind, but will preserve their quality and enjoyment of the rights that we all want to be able to be functional, to achieve in our workplaces. Schizophrenia doesn't have to keep you from being able to be productive in your career. Or any other condition for that matter. So patients are being hit at the earliest stage of their professional development, and being able to have access to ongoing seeing your doctor, being able to have access to the wonderful medications that are now available will be so important in terms of lifelong productivity and quality of life and health. I just can't even speak to how important it is, especially in the area of mental health.
Certainly, and just to add to that, and I'm glad that we kept it high level because again, health is on a spectrum, right? It's not a yes or no situation, and a lot of community members, as mentioned, are living with PTSD. Or depression, anxiety. We see stress from work and other things that really just drives down well-being. And when you have access to a regular source of care, you are able to manage or increase that well-being. And then that's before we even dive into the implications that mental health plays on behavioral health as well, or trying to manage and cope and you're medicating yourself and the implications that has. We forget that we are also in the middle of an opioid epidemic that is really hurting Black men, especially in North City and North County, while the rest of the state has demonstrated a decrease in overdose deaths. And so that access to Medicaid will allow for providers who are intervening in opioid use disorder, co-occurring disorders, to be able to provide chronic health management and preventative care that is recommended for integrated care for addressing addictive medicine. So that is so critical for a wide spectrum of community needs.
And we see here at Christian, having the busiest emergency room in the state, we see 1 to 5 overdoses every day. And when you talk about people medicating themselves, hopefully we get to the point where people won't have to medicate themselves because now they have access. And as Bishop Jones says, they won't have to suffer in silence. As Dr. Anafati says, it gives them access now. And so here's an alternative as well, because it's no fun having to pull somebody out of a car that has overdosed, or somebody has just dropped them off and thrown them out of the car because they have overdosed. And those are real life situations we see here at Christian. And we definitely want to give people back their life and the quality of life as well. How many people, Leanne or Mike, how many people will benefit from expanded Medicaid expansion here in the state?
So it's well over 230,000 people. There's more about 380,000 that are totally uninsured and could fit into that coverage gap. But you don't start day one and make sure everyone can get on. It will be available if it passes, and God knows I pray and hope, and we're all working hard to make sure it passes. If it passes, then it will be available as of July 1, 2021. That is what you are voting yes for, is to let it be available July 1, 2021. But initially, the initial folks that we believe will come and access through Medicaid insurance is about 230,000 people, and it's very diverse. We live in the urban suburban area of St. Louis, but frankly, there are more uninsured low-income people in rural areas than there are in the urban areas, suburban areas of Kansas City, St. Louis, Springfield. So it's very interesting to see how this whole political spectrum is going. Healthcare doesn't have a race, it doesn't have an age, it doesn't have a sex. It just knows what it needs. This should be the great equalizer. But as the doctor said, in this pandemic, we've seen how severely it hits people of color, most especially, and the disparities that exist in healthcare. So I've gotten off a little bit on a tangent there, but this is a statewide issue with over 230,000 people that we believe will immediately be able to access Medicaid expansion July 1, 2021, if we all vote yes.
And to add to that, everyone will see the benefit, right? That this extends well beyond just the access, but as mentioned, the economic impact. But I do want to point out one thing in the expansion and who's now covered with expansion. This really gets us to a place where we're able to respond to context equitably. Where rural communities have access problems, urban communities have access problems, and with different contexts, with different lenses, we're able to address those issues with this new expanded coverage. And so, as Leanne mentioned, it expands to 300 plus thousand, but we approximate about 230,000 will enroll. But what we do know and what we do see is these issues have a broad impact on communities from St. Louis to Kansas City to Southwest Missouri to the Boot Hill and SEMO to Northern Missouri as well. And so we want to just really highlight that this impacts our entire state. This is not welfare, whatever myth that there is about handouts to specific demographics and communities. This is far from that. This is a comprehensive policy that addresses a lot of issues in many communities far and near to St. Louis.
Well, you talked about the rural areas, and I know a lot of times people have been saying, well, this is just going to benefit the urban areas, St. Louis and Kansas City. But we know we've had rural hospitals closed. How many rural hospitals, Mike or Leanne, have we had closed?
We've had, 10 closed since 2014? And there's 26 medical centers that are vulnerable of being closed if Medicaid is not expanded. 26.
And those individuals, because they don't have care, have to come to an urban area. And so what we'd like to do is, again, stand people up so they don't have to travel as far, because depending on what your situation is, Dr. Afani could attest, time matters. And we want to make sure people have that access where they are in their community. To the panelists as well, to everyone, and maybe start with Mike, how do you talked about equity. How do you see this as health equity in the state of Missouri?
I see it as a step in that direction. I don't want to make this seem like it's a one stop fix all, because we know that's furthest from the truth. However, it gets us in a step in the right direction to address those who are really just lacking in our community. We talk about eligibility and that gap. Majority of those individuals are our essential workers right now, our frontline staff that are working the front lines of our healthcare facilities, our housekeeping, our maintenance crews, sanitizing rooms, and keeping our long-term care facilities clean, our food service workers, our grocery store workers, all of the individuals we now see that are so important to the fabric of our community well-being, now having access to care, and they don't have to choose between preventative care, preventative screenings, care management, or taking care of their families. And so this is a step in the direction of both health equity, meaning that access to quality, affordable care. But we do know that's just one piece of the pie when we look at those determinants of health. And so we have seen the implications of our budget crisis in the state of Missouri. So this also begins to help us to manage our budget better, where we're not cutting public safety, we're not cutting education, we're not cutting infrastructure, because we do know that the communities that are most affected by those budget cuts when they happen are those communities of color, those communities of poverty. And so when looking at this from a broad or a 30,000 foot view, you're able to see those tangential implications outside of health. And so that's when we talk about equity, really making sure that we are addressing context in which a lot of these issues occur.
Leanne, when you opened up, you mentioned about 36, 37 states, Oklahoma not too long ago approving to expand Medicaid. And I know some people are worried about, well, you know, what if the government says we don't want to do it anymore? But you've mentioned as well, it takes an act of Congress
Yes.
to overturn all this.
Yes, it is in the law. So that means that the 36 states, again, Michael just said, we got a vote of the people in Oklahoma, and we're going to do it in Missouri. Those 36 states already are enjoying that 90% federal match. So I cannot imagine how 36 states are going to say, don't give me that federal money anymore that I'm sending to Washington. Don't let more people be covered under Medicaid. It's simply not going to happen. I can't emphasize enough what earlier point that Michael had made. Medicaid has been out there for 55 years. What expansion does is make sure that across the country, we're all getting insured at those lower income levels. And I did want to mention just about one misinformation that's out there. 71% of the people who will be eligible for Medicaid expansion work full time. They may have two jobs to make up that full time, and therefore they can't get insurance under their provider, but 71% work full time and another 14% work part time. These are low income people that are really trying to do the right thing. They are struggling, and we want to make sure at least their health care can be covered.
And if I may add to that, that 15% of non-workers that's remaining that Leanne just mentioned, majority of those non-workers are our seniors or our folks living with disabilities that may have assets that doesn't allow them to qualify for Medicaid, or they have a huge spend down and they're in a gap where now if their finance or their eligibility now fits within the new criteria, that they don't have to have that large spend down in order to get the care. They don't have to have less than $2,000 in assets or $1,000 for someone who's single a month. And so again, this myth about working handouts or incentivizing people not to work rather is a total myth. And we just want to continue to elevate that here and until August 4th, especially.
Michael, earlier you talked about the economics of Medicaid expansion. And so I know there, and Leanne as well, and to the panelists as a whole, I know there have been studies that have been put out, mainly, specifically, I guess, Michigan, Arkansas, and maybe some other states about expanding Medicaid and how it's benefited those particular states. Would anyone like to talk about the benefits that you can see? Arkansas, red state, You can see Michigan, blue, red, but there are benefits that they've seen from Medicaid expansion.
Yeah, I'll just give the campaign's view, and please, Leanne, I know I see she has the stats right in front of her, so we definitely want to use that. But how the campaign is communicating the economic benefit. First, we're going to protect those frontline jobs that are at risk. As I mentioned, the 26 medical centers that are at risk, but then also creating new jobs. And so this will create 16,000 jobs annually. And that's jobs that are paying a livable wage, $15 an hour or more, with 40% of those going to our urban cores and 60% of that going to our rural communities throughout the state. So those are quality jobs coming back into our communities, and so desperately needed. And then you see the impact that it has on cost savings. Where Arkansas, Michigan, for example, have demonstrated $500+ million in cost savings over the last 3 years in those respective states. As I mentioned, we're in a budget crisis. The governor is already cutting from particular departments and line items. And so this allows us more flexibility. Again, those tax dollars coming back to our state that we're already paying. And then you just think about just the impact that has on workers. When we have a healthier workforce, we have a better functioning economy. And so that's just simple economics. And so when you look at the totality of it, we're bringing back billions. We're creating 16,000 jobs annually, protecting jobs that are at risk in our community health centers, our federally qualified health centers, our medical centers in rural communities. But then we're also creating a healthier workforce. And so you see that economic benefit really serving not only those who now have access, but everyone. Because if my tax dollars are coming back to Missouri, then I am happy. And if that is able to help my fellow community member, then I am really happy with that, because that's the whole point of really paying those taxes. Is we want to see an improvement in our communities, and so I can't speak enough about the moral impact, but also that fiscal impact it has on all of us.
The only thing I would add to that eloquent statement, Michael, is that certainly the business community, so the state chamber, the Missouri, the regional, St. Louis Regional Chamber, Kansas City Chamber, Civic Progress, those folks would not be supportive of this if they thought their taxes would increase or services would be diluted. They have all combined into this diverse coalition to support it. And the states that Michael mentioned are far beyond that, but Kaiser Family Foundation has shown that in Louisiana, Virginia, Michigan, Montana, Nebraska, Kentucky, Arkansas have all seen a positive fiscal impact by doing Medicaid expansion, so much so that Arkansas did a tax refund because of their Medicaid expansion. So there are a lot of savings that happen. That's why we have business community, labor, the faith community, providers, healthcare providers of all sorts, 330 some, did you say we're up to today? Organizations, because there is a positive fiscal impact.
Absolutely. And I think we just have to continue to talk more about the positive, because there's so many positive stories out there as well. And to the panel here, specifically Dr. Anafati, Bishop Jones, Michael, and Leanne, question came in. Why should it matter to the people who already have insurance that we expand Medicaid? Why should it matter? I have insurance, so why should it matter if someone else can get insurance?
Well, can I what I would like to say to that, number one, from a moral perspective, it is simply the right thing to do for your brother or your fellow citizen. The second thing is that when you help somebody who has been dealing with Medicaid and you're only making $300, or you only can earn $300 a month or so forth, you also don't think about the psychological effect that person has of being really a person of no value to our community. When you have to make a choice between food or medicine. So if I have insurance, I'm enjoying good health care, I should want to also help my fellow man
Yes.
have good health care too.
Anybody
Hello.
else like? Oh, Dr. Anafati.
Yeah, this is Dr. Nifadi. Thank you, Bishop. I'm going to answer it from the selfish perspective. You've already covered the other end. Healthcare or loss of healthcare, major health crisis is among the top reasons why people go into bankruptcy or fall into poverty because of inability to continue working. So, from a self-preservation perspective, anything that provides a safety net into which I, even as a physician, could possibly fall into, were anything untoward or bad to happen that prevents me from continuing to earn a livelihood that keeps me above poverty line or being able to take care of myself and my family, I welcome that. And especially in this COVID environment where you may not ever get COVID, but you can still get COVID by way of job loss and economic instability. We are all in a situation where we are at risk of getting into economic crisis. And again, anything that permits us to continue to maintain our physical health and mental well-being in the middle of economic crisis is a welcome safety net. So as it is good to try and take care and be kind to your neighbor, it is also good and necessary to try and take care and preserve yourself. So Medicaid expansion can be part of that risk management plan for all of us. Thank you.
Very well said.
Amazing. It's hard to add to that, but there's so many benefits far and wide. And so, as Leanne mentioned, Arkansas, as an example, the benefit it's had for the entire state. And we will see that in Missouri. We see constantly, you turn on the news, we have kids being shot. We've seen just the implications of drugs that have had on our rural communities, on our urban communities. We've seen just all of these issues, right, that make up this this comprehensive ball of mess that can be addressed through public health. And with public health infrastructure, the right support and resources for hospitals, for community health centers to respond, we're not only able to address the chronic health needs and conditions or preventative care that's needed for our community, we're also able to support them socially, respond to address some of the social impact that stress, mental health, behavioral health, living with a chronic health condition, living with cancer has on households, on our community members, on our neighbors, on our colleagues, friends, and loved ones. And so what's best is stories, right? And we have to realize that COVID just happened, but the inequities, the issues exist long before that, but it's just being highlighted. But I just want to dispel the myths that is associated with it. And so during my time at Mercy Hospital, I had the chance to work with a young lady who came in. She had just turned 19 and she was headed to the military. Her father had just lost his job and the family was covered under her father's insurance. So she came in without any insurance, headed to the military, and she was on the right path. But she developed a condition that the doctors really struggled to treat for a while. She spent 3 months in the ICU at Mercy Hospital, another 3 months at BJC WashU neurology in their ICU. 6 months. 3 of those months at Mercy cost that family $1.2 million in medical cover in medical costs. And they were actually, I couldn't believe that they were actually receiving those bills. And so what we were able to do is get her apply for Medicaid, and she was now disabled. But we see the implications that if the state did not deem her disabled and to get that coverage, you're talking about millions of dollars that family can't pay. And then the health system takes on that burden and they pay those costs. And those are dollars that now doesn't go to community benefit or in other places that are needed. And so this is an example of the high cost of care that many hospitals are taking on because of those who are uninsured. And so we want to be able to address that because, yes, it expands access for a person, but when that person does not have access, that has ripple effects throughout our community. And so I just wanted to share that story because that really changed that father's life, and it relieved a burden on him that many of us cannot fathom.
Well, it goes back to Dr. Anafati's point. Go ahead, Dr. Anafati.
That's exactly what I was going to say. It's also a wonderful illustration of how the Medicaid expansion is a safety net for all of us, because we never know. I'm sure this poor young lady did not expect to fall ill and to have her life altered, nor did her family. And you guys being able to get her access to the Medicaid not only helped her as far as her health and continued care, but it also helped the family. And so that's just a perfect example of why Medicaid expansion is not just for your neighbor, but it's also for you.
It also goes to Bishop Jones' point of a moral responsibility as well. That's a great example, great story, which is very true, and why we need to expand Medicaid in the state and why it matters to those of us who have insurance as well. Hey, Brad, I want to go ahead and call the audible, and can we go ahead and show the video? It kind of gets to some of the things that Mike talked about as well. So we have a video we'd like to show you. It's about 4 minutes or so.
3 minutes.
And so 3 minutes? Okay, yeah. Even better. And so Brad is queuing it up, and here we go, real soon here.
I've been walking with my face turned to the sun. Weight on my shoulders, a bullet in my gun. Oh, I got eyes in the back of my head, just in case I have to run. I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones. Early in the morning, before the sun begins to shine, we're gonna start moving towards that
Well, I go to prepare a place for you, and so that's what we're trying to do now is prepare a place for a lot of individuals. And so I will say that the video here was a timeline of capturing the campaign, and so you saw some people had masks, some people didn't. So just realize a lot of this was done before March when COVID really came in. And so as Leanne said earlier, this has been going on for about the last couple of years. Right, Leanne and I specifically at BJC, Mike, I know you have. We've been preparing for this day that's coming up on next Tuesday, and I see Leanne shedding little tears there. And so the video is emotional, and the video pulls at you as well. And we are trying to prepare a place for others as well. And so we'll end on what do we need to do next? How do we make sure we vote? If you absentee vote, what is the rule on that? And so that's a question that I had, and that's a question that's come in as well. Ways we can help get the vote out. So let's just talk about voting and how we get to go vote, absentee voting, and as we come into these final days here.
So just jumping right into that question, if you have an absentee ballot or a mail-in ballot, you should get that returned as soon as possible. As soon as possible, especially those mail-in ballots. If you have an absentee ballot and you just so happen can't get that turned in, you can take that on the day of the election, August 4th, into your polling place. If you live in St. Louis County, it doesn't matter what polling place now. You can go to any polling place if you live in St. Louis County, turn that ballot in, and vote in person. We just want to make sure those who are voting protect themselves, wear a mask, hand sanitizer, social distancing. It should be a beautiful day. The rain has come in, cooled us off. It should be low 80s on Tuesday, which, you know, in August in Missouri is not kind to us often, but it is kind to us this Tuesday. And so just really protect yourselves, protect your loved ones. And again, if those ballots are not turned in, go ahead and submit those. It should have been done yesterday. So go ahead, get those in. In addition to that, what I'll share with you, Rick, is ways that everyone who's listening can be a digital ambassador, meaning they'll get real-time infographics and information that they can send out to their friends and families. If we would text 10 and ask our friends to text 10, before we know it, there's an exponential increase of who's receiving that information. And so you could be a digital ambassador. There's still opportunities to support our Get Out the Vote strategies. If you want to volunteer to phone bank or text bank, you could certainly do that. In addition to any organizations that are on the webinar or represented, they can also share information across their staff lists, across their networks, and for their stakeholders. And so we want to get that information to you. And so you can contact me at Michael, Mikel, at healthcareformissouri.org. But I'll also share this with you. If it could be shared in a follow-up of some sort, we can get that information out to you. But again, Mikel at healthcareformissouri.org, and I'll make sure you have everything you need to share, to blast from now until August 4th. And again, for ways you can get involved as well. Oh, there you go. Thank you.
We have it up on the screen as well. Leanne, anything you'd like to share as well on the voting?
Well, every vote matters. Oklahoma only won by a 0.5 percentage point. Oklahoma only won by 0.5 percentage point. So everybody you know in your network, that text 10, tell 10 is really important. You're more influential than I am to somebody who doesn't know me. So please go out and vote. It will matter. If you know somebody who needs a ride to vote, I know, Michael, there's resources through Lyft that you may want to put on that website as well that will take people on a round trip journey back and forth to the poll. And again, Christian Hospital has been there from the beginning of this journey, and so have so many of my brothers and sisters. That's why you might have seen me well up a little bit. I've seen that video about 5 times, and it still hits me. because it has been a grassroots effort. It's every person matters, and every person needs to come out on August 4th. Please vote yes on Amendment 2.
One last question that's come in is, Leanne, you talked about when it passes, it'll go into effect July 2021. When would enrollment start for those who would qualify? When would they start enrolling?
So with an air of optimism, Missouri Foundation for Health is already gathering people next week to talk about implementation. There is a process that has to be done through federal regulators as well. So we know that this may not be the end of this. We know that there are opponents out there who would like to derail it beyond it being a statutory constitutional amendment. So while that is what the language says, there are some regulatory concerns you have to go through. Those should be done by the end of March if all goes well, and people will start to be able to enroll then. So probably within 60 to 90 days before it actually would kick in, if we are not faced with hurdles that we cannot overcome.
Okay, great. Dr. Anafati, any last words you'd like to share with us?
And I think we've just had a wonderful session, and thank you so much for inviting me to join this terrific panel.
Thank you for being a part of this as well. Bishop Jones, any last words you'd like to share with us?
Yes, sir. I just want to say to everybody, just go and vote. Do the right thing, and let's make our state a healthier place by giving everybody access to expanded Medicaid.
Thank you, Bishop Jones, and thank you for being here.
Thank you.
Michael, any last words for us?
Yes on 2, yes on 2, yes on 2. It's as easy as that. But as I mentioned, and as Leanne mentioned, there are resources that are at the community and those who want to get involved and who need a ride to the polls, whatever the case may be, we want to make sure you have that. So please reach out. I'll also share it with you, Rick, so that if you want to blast it, you're more than welcome to. But we want to aid, support all of those community members represented in that video who have fought so hard for us to get us to this point. And we want to continue that and carry that through August 4th. Because we know how important yes on 2 vote is.
Absolutely, and Lyft and Uber is providing those rides, and we will send that out, and also we'll put up at the end your information again, and you can tell individuals how they could, or tell others how they can access Lyft and Uber for a ride to the poll as well. And I'll end it with Leanne. Any last words, Leanne?
You know, what an amazing panel, and thank you, Christian Hospital, and all of the community there. You've been with us on this journey a long time. Those grassroots organizations matter. They have made their voices heard. And now if we can get all of their members to come to the poll, we will win this, and we will get more people insured in Missouri. So thank you for letting me participate.
I want to thank all the panelists here today, and especially Leanne. You've been on this journey way before I came to BJC 4 years ago. And so we're going to bring this home on Tuesday as well. And Brad, if we could just end with the information just showing the yes on 2 and Michael's information. And so I'd just like to thank everybody that has participated this morning. And I'd like to thank our panelists again. And I'd like to thank all those who are listening as well. And please also take advantage of what's going to be shown on the screen here momentarily about people needing rides to the polls, about contacting Michael Whittier or Christian Hospital, and also take advantage of texting 10 individuals or calling 10 individuals or taking someone to the polls yourself. And as we've already heard, we don't want people to suffer in silence. We want to make sure we have this moral compass. And at the end of the day, it helps everyone. Everyone gets a piece of the pie. And if someone gets a piece of the pie, it doesn't mean your pie gets smaller. It just means the pie just gets shared a little bit better. And then healthcare, the society that we live in, just gets better as a whole from that standpoint. So thank you again. We look forward to having you at our next Community Leaders Breakfast, which will probably be in September. And we're going to talk about some of this great services that we have here at Christian that after we pass Medicaid expansion, a lot more individuals will have access to as well. So thank you. Have a great day and have a great weekend.
Thank you.
Thank you. Thank you.